This video will go through the management of soft tissue injuries from the initial assessment to short and long-term treatment, then to rehabilitation exercises and injury prevention strategies.
So my main idea for the modification was that if we could quantum lock the flux capacitor, then we'll get a much larger output from our hyperdrive. And look at this noob. Look at him, he's training for his little basketball set. Never do that. But if an emergency was to occur, what? Emergency! Come on! I'm going to make my primary survey.
In the initial assessment of a soft tissue injury, the acronym to follow is TOTAPS. The first letter T stands for talk. Talk to the athlete, ask them how the injury happened, and if they heard any sounds like the cracking of a bone. This gains more information about the situation and cause of the injury, and it helps to determine the type and extent of the injury.
What happened? What happened?
I was running and then I twisted my ankle.
Okay, you twisted your ankle. Did you hear any cracking sounds like a bone?
No, nothing.
Bone?
Cracked.
Okay.
The second letter is O for observe. Take a look at the injury and check for any obvious swelling or discoloration. This offers further help with injury identification.
Okay. Can I just take a look at your ankle? Can you take your hand off it? Yes. Can you take a look at his ankle?
The third letter is T for touch. Feel for any noticeable swelling and then gently prod the area with 2 fingers and ask the athlete to rate and describe the pain. This helps determine more information about the type of pain, and it also helps to pinpoint the pain.
I'm going to touch his ankle. I'm going to prod it a few different times. You just tell me how much the pain is on a scale of 1 to 10. Right?
About 7 right there. Yeah.
Okay. Lie back on your back.
The fourth letter is A for active movement. Have the athlete stretch out the injured body part, in this case his ankle, as much as they can in every direction without causing excessive pain. This determines the severity of the injury.
I want you to move the ankle. Try to flex your ankle as much as you can.
In this instance, the athlete was unable to do active movement without causing pain. But if he could, you would then move on to the next letter, P, for passive movement. The assessor then moves the ankle through a range of movement with their hands, stretching it as far as they can. However, this must also be without causing serious pain. If the athlete can pass the passive movement stage without excessive pain, the next letter is S for skills test. The athlete will perform a skill required by the sport, like a sidestep for basketball players. If they manage to pass all the tests of the injury assessment, including the skills test, the athlete may continue play if they wish. After my assessment, I determined that the injury was a sprained ankle. For short-term treatment of an ankle sprain, the acronym to follow is RISA. The first letter is R for rest. Rest helps to avoid further damage. Avoid movement as much as possible and make sure not to put any weight on the injured part of the body. The second letter is I for ice. Apply a cold ice pack to the injury for 20 minutes every 2 hours. Continue this treatment for the first 2 to 3 days. Ice cools the tissue and reduces pain, swelling and bleeding. Make sure that the ice is not directly on the skin, have some sort of material in between. The third letter is C for compression. If possible, apply a soft compression bandage covering the injured area as well as the areas above and below. This also reduces swelling and bleeding. Make sure the bandage isn't too tight and doesn't cut off blood flow completely. The fourth letter is E for elevation. Elevate the injured ankle on an upwards angle to reduce blood flow and stop bleeding and swelling. The final letter is R for referral. Refer the injured person to a qualified professional, such as a physio, for ongoing care and treatment. A full recovery is then more likely.
Hello, is Dr. ABCD there? Hello. I just wanted to inform you that I've sprained my ankle. It's a indirect soft tissue injury. So I was wondering if I could come see you and if you could check it out for me, see how bad it is. Does Thursday 12 o'clock sound good? Okay, thank you. See you then.
For long-term treatment of an ankle sprain, it is advised to strap the athlete's ankle with some rigid sports tape. This helps to support and reduce stress on the ankle during activity. It aids with the healing of the ankle injury and will often allow for an earlier return to sport or an activity following the injury. Proper rehabilitation is a vital part of injury recovery. One good exercise is balancing on a wobble board. This helps to strengthen micromuscles in the ankle and improves proprioception to return the athlete's balance to 100%. Another good rehabilitation exercise is known as the windshield wiper and is shown here. This increases mobility in the ankle and it helps the tissue to heal without scarring. A third rehabilitation exercise for a sprained ankle is the towel stretch. The athlete wraps a towel around their toes and pulls it back towards their body. This increases the range of movement in the ankle and it also helps the tissue heal without scarring. After an injury, it's important that an athlete progressively returns to training for their sport. This can be done by gradually increasing the difficulty of training exercises back to pre-injury level. As with everything, prevention is better than the cure. There are a few techniques to help reduce the risk of an injury occurring in sport. One of these is sufficient training. Ensure that all athletes participating in any level of sport also participate in an equal level of training for that sport. This helps prepare their body for the activities involved in play. Another vital injury prevention strategy is a good warm-up before every match. This helps to stretch the body's muscles and prepare them for the intensity of the upcoming game. And finally, especially for ankle injuries, it is also very important that all athletes wear shoes that are protective and appropriate to their sport.